Good afternoon. Thanks for joining us. We're excited to walk you through the More for Your Smile campaign and how you and your patients can be part of it. I'm Melissa Albertson. I'm the Communications Director for the MDA. And joining me today is Meredith Krantz. She's our campaign consultant, and Grace Riley, our legislative liaison and lobbyist with our longtime contract lobby firm, Gamble and Schlemeyer. So we're going to try to be efficient and effective today in getting this information to you. We're going to cover the campaign aspects. We're going to give you a little bit of a legislative overview for dental loss ratio, where we've been, where we're going, how you can get involved with the campaign, the different pieces of it, and then any questions you have. And if you do have any questions, if you'll just pop them in the chat, we'll wait and address those at the end. But that's kind of what we're going to cover today. And I'm going to turn it over to Meredith. She owns Krantz Strategies and has helped many other states do a similar campaign like this, which is dental loss ratio, to pass the dental loss ratio, but branded under the More for Your Smile branding to better engage patients in the conversation. So she's going to walk us through the campaign development and process. Take it away, Meredith.
Thanks, Melissa. So Krantz Strategies, we're a boutique public relations firm. We specialize in public policy and strategic communications campaigns. So I've personally worked both inside and outside state government in the state of Illinois. So I do understand just the dynamic nature of the legislature. And so when it comes to More for Your Smile, it's a dental insurance reform campaign, very broad umbrella in that we first launched in Illinois with the Illinois State Dental Society 3 years ago. So since then, I've brought this campaign working with Alabama, Rhode Island, Nebraska, and West Virginia. So Rhode Island, the first year that we worked together actually had success in passing their dental loss ratio in their legislature. Illinois also achieved several dental insurance reform laws that were signed into law from the campaign. And then we're also hopeful that Alabama's also nearing an agreement that could be successful this spring. So now I want to introduce the campaign More for Your Smile and more of the strategy behind it. So I think some people might ask the question, well, why is it called More for Your Smile? Our hope here is that we're taking something complicated and explaining it in a way that patients understand and that lawmakers are motivated to act on. So when we think about the phrase dental loss ratio, I think it's a complicated policy concept, even for people who work in the insurance space and in dental offices every day. The phrase, itself doesn't resonate well for people. Nobody wants to lose anything. When it comes to the word loss, people want more of it. And so More for Your Smile was built starting with the patient first and then working backwards. So patients want more for their smile. They want more value. They want more transparency, more accountability from their dental insurance. And so patients think, I pay for dental coverage. I should be able to use it. Meanwhile, we know that dentists, all of you're seeing delays, insurance denials, and your patients having care that's put on hold. For lawmakers, they hear that it's a complex, policy, and they're hearing those insurance talking points. And so our goal with this campaign messaging that we're reviewing today, we want it to close the gap. So we're intentionally putting patients at the center of the story. We want to reframe the issue from something that's very complicated, insurance regulation, to something that has people at the center of it. And so this campaign is definitely, it's patient first by design. Okay, so now that we understand the strategy, let's talk about the problem and solution through this frame. So right now in Missouri, there is no requirement for insurers to spend any portion of dental premium dollars on patient care. So that means families and employers can pay every month, and up to 40% or more of those dollars may never reach their care, which means delays, denials, and patient care put on hold. So I think if you tell somebody, your insurer may only be putting 50 cents of every dollar towards actual care, people understand right away that that's not a very good deal. And so our solution, it's simple, it's reasonable. We want to require insurers to spend at least 85% of premium dollars on patient care, or patients get the refund. It's the same standard that's already in place on the medical side. So all we're doing is asking for that parity. And I think when we explain it this way, people understand what's going on and what we can do to fix it. So In this framing, it's not about dentists asking for more. It's not that at all. It's about patients getting more and getting access to the care that they already pay for. So people pay for dental benefits. They should be able to use them, and it's that straightforward. Okay, so now into our messaging pillars. These are the home-based messages for the campaign. They help us stay consistent and focused. I'm sure if you're like me and most people, we don't remember everything we hear the first time we hear it. And so we've got to have it repeated. So these are the three ideas that we want Missouri to hear again and again. So if what we're saying fits into one of these pillars, you're on message. We want more transparency. So this pillar is about helping people understand where their premium dollars go. It includes messages about clear reporting and whether coverage is actually working the way patients expect it to. Transparency, it's a basic expectation and it's easy for people to agree with. More accountability. So this pillar really grounds our solution. When we talk about accountability, we're talking about making sure that premium dollars support care and not just overhead and profit of insurance companies. We believe insurance companies should be held accountable to their policyholders. And then we think about more value for patients. I mean, this is really where the focus belongs, and ultimately what we're looking for. It's about access to care, prevention, staying healthy, and avoiding those delays caused by insurance. And we know that when more dollars go to patient care, people are going to get the value that they're paying for. That's the outcome we want everybody to stay focused on. And so these pillars are going to help us stay, patient first, clear, credible. That's more transparency, more accountability, and more value for patients. So next, I'm going to hand it over to Grace, who's a lobbyist with Gamble and Schleiermacher, the MDA government consulting firm. She'll give us more of an overview on DLR legislation, how it works, why it's important, and the MDA history with passing a DLR.
Yes, thank you, Meredith. So voters strongly support reforms like this. Massachusetts passed a similar policy with 72% voter support. They followed a different path using a ballot initiative than we are using now, but overwhelmingly, when voters understand how much of their premiums may never reach their care, they want change. So we see the same thing on the medical side. Medical has been following this loss ratio percentage for 15 plus years, showing it works. When insurers fall short, patients benefit through rebates. In fact, they've issued over $1 billion to millions of consumers since the Affordable Care Act went into effect. It's proof that loss ratios directly benefit families. And importantly, this didn't destabilize the market. Plans adjusted, consumers benefited, and coverage options were made. We're aware that some opponents raise concerns about market disruption, administrative burden, or reduced choice, but the real-world data, both in medical insurance and in states that have adopted dental loss ratios, doesn't support those claims. So well-run plans adjust spending and stay in the market. Insurers already track the data they need to comply. It's not a new administrative lift. It's simply about reporting it and meeting a fair standard. With a DLR, they simply spend premium dollars where people expect. When more of your money reaches treatment, everyone wins. Higher standards and more transparency lead to better choices, stronger protections. Patients see more value, and dentists see fewer barriers to care. Now, it's important to take a step back and look at what's happening across the country. Several states have already enacted DLR laws. We talked about Massachusetts, but also North Dakota, California, Maine, and Rhode Island. Here in Missouri, our work on DLR has been deliberate. In 2024, legislation was filed for the first time to formally introduce the concept and begin laying the groundwork. That year was really about education, introducing lawmakers to how dental insurance operates, why transparency matters, and what a fair standard could look like. Based on those conversations, the legislation was revised heading into 2025. Updates included excluding charitable contributions from the numerator when calculating the dental loss ratio and adding a penalty for delayed rebate payments to ensure accountability and timely compliance. In 2025, the revised legislation was referred to committee. Lawmakers expressed genuine interest, but they also consistently told us they wanted to see real-world outcome data from other states before moving forward. So now moving towards 2026, Missouri is in a much stronger position. States like Massachusetts are completing their first full reporting period. A growing number of states are also actively pursuing the legislation. It's becoming a national trend in the policy space. We're getting stronger data, which is helping grow support and a clear path forward. Knowing the challenges this legislative session faces, it was important for MDA to secure strong, credible sponsors early, before session even begins. That early outreach reflects the relationships MDA has built over time and the trust lawmakers have in our priorities. In the Senate, we're fortunate to have Senator Jill Carter returning as a sponsor. Senator Carter sponsored our legislation in 2025. As chair of the Senate Family, Seniors, and Health Committee, she brings an understanding of the patient-focused policy and consumer protections. In the House, Representative Jeff Barden is serving as our sponsor. Barden worked for 35 years as an optician. This background gives him a practical understanding of how insurance decisions affect both patients and providers. In a session with real headwinds, lawmakers need to hear directly from the people experiencing these issues firsthand. This is an election year session, so that means legislators are balancing a crowded agenda and prioritizing issues that resonate quickly with voters. We're also seeing increased partisanship and a focus on high-profile or controversial topics, which can make it harder for thoughtful, policy-driven proposals to move on their own. That's why hearing directly from patients and providers, especially constituents in their districts, matters so much. So with that, I'll hand it back to Melissa to cover what's in the campaign toolkit you'll be receiving in the mail.
All right. Well, I'm excited about this. This literally was delivered to me just moments ago from my printer. This is mailing out today. And so I'm excited to talk about this. It's a different campaign, kind of as Meredith talked about for us at the MDA. We've talked a lot about when it comes to dental insurance reform issues, but we really need to engage the patients, that it doesn't seem like it's just the doctors advocating for this. And so that's what's unique about this campaign. So I'm going to go over like our top 5 things, if you don't take anything else away from this, things that you can do with this campaign. So like I said, a campaign kit is mailing. It's gonna, if you can see, it's gonna come in an envelope. It's gonna look like this. It's going to all practice locations. So not every doctor is going to get it. It's going to go to addresses where there were duplicate doctors. We're sending it to each address. You're gonna get 3 campaign posters just like this. It looks flat, but when you pop it out, it's got an easel on the back that's ready for you to put in visible areas, waiting room, patient checkout, financial consult room, operatory. We also have extras, so if any doctors feel like they could use some more in their practice, they can request those. And so, you know, something it says in the cover letter that you're going to be getting is that your practice is the most trusted place for these conversations with patients and to encourage them to take action on their behalf. One anecdotal story about the poster and working with the office manager and getting ideas about what would work best in the practice. She said, just today, I had somebody in here who was frustrated by their insurance, and I would have loved to have been able to show them something like this and say, we advocate for you all the time. Now you can advocate for yourself. And so that's a way for patients to do that with this campaign. A key aspect of the poster and the campaign is the call to action. And you'll see the QR code. You'll see it on the screen. It's very large. It's the main feature, the main image, you'd say, of the poster. And that's because when they scan that QR code, they'll be taken to a form. A lot of our dentists have probably seen these forms when we've asked you on a call to action for a legislative topic. This is going to be patient-based. It is written to be patient-based and focused, and to literally in just a few seconds send a message that has their name, fills out their home address very easily, sends that message to their senators and representatives. And I'm going to show the website in just a moment and how easy that is. Oh, I went back one too many. Sorry about that. We want you to contact your lawmakers too. We have a toolkit page that actually has the exact same type of form, but it has a pre-written message for dental professionals. So for doctors, for your team, just to send to your elected officials as well to support this message. And then we're going to have social media starting around this at the beginning of the year when session begins. Also, we'll be doing some paid social placement around Legislative Day, Dental Day. So that will all be coming up. I'm going to show you real quick the website. All right. So what you're seeing right here is the screen of our website that's been created. And you'll see the main buttons, the main things we want them to do is to contact their legislators. Yes, there's information on here. There's a video they can watch that we made with one of our members in Fulton. There's those talking points that Meredith talked about. There's even an FAQ page if they really want to dive deeper. But the main point is for them to get taken to this form to fill out. And I won't read it all, but it starts in, as your constituent, I'm asking for your support to make dental care more accessible for all Missourians. It talks about these bills. It talks about this topic. They fill out the information and click it, and it gets sent to their lawmakers. The practice toolkit includes all these things we're talking about that you're going to get in the mail. A few other things, you can download the poster if you want more. It's got some screensavers. You can download the video depending on your TV system if it's something you want to play. And so all of that is available. Just to show you, I've got it up. We expect, most people are going to scan this QR code and go on their phones from it. That's what we want you to do. Show them how easy it is to scan the QR code. Hopefully, most people are really familiar with that. So many people use QR codes for these types of things. And just to direct people, whatever the campaign might be. But when they scan that, it's going to take them right to that form to fill out. So it's very easy to do. And that is what's on your website. Like I said, we also have the campaign video, and I encourage you to go watch it. I'm not sure how good the music will come through in the voice.
Too often, you think thinking it's going for speed. But in Missouri, dental insurance can pick up to 40% of your money.
So it's a very short 60-second video that helps explain it to members as well. We'll be using this video in social media and other formats to provide that quick education and make those salient points about what this law is about. I'm going to go back to my presentation. All right. Like I said, it's right there, very easy to do. And the biggest thing that you can do with all of these campaign materials as they're coming to your practice, share them with your team. Get those salient talking points that you want to share with patients. We know we're asking you to participate with this in your practices, but we really feel like that's where we can make the most difference with this campaign and moving this forward. And number 5, in terms of importance, is joining us at Dental Day at the Capitol. It's Wednesday, March 4th. If you use your phone right now and scan that QR code, you can register if you have not. I'm going to turn it over to Grace. She'll just talk a little bit about the details of Dental Day and why it's so important to have our members turn out there. Grace?
Yes, like Melissa said, this is one of the most important ways you can support this effort by joining us for Dental Day at the Capitol. We strongly encourage you to register, and I want to flag that the registration deadline is Monday, February 9th. That gives MDA enough time to schedule legislative appointments. So once you register, there's really nothing else you need to do except plan to attend. MDA, we handle the logistics, we set the appointments and provide the talking points. You won't be asked to figure out any of this on your own. It's also a great opportunity to invite colleagues from your area to join you and to maybe carpool. So if you've attended Dental Day before, your participation is especially valuable. Experienced attendees help newer participants feel at ease, and they allow us to pair dental students with seasoned dentists, so everyone gets the most out of the experience. Ahead of Dental Day, MDA will host a briefing webinar to walk through the legislation, review key messages, and answer any last-minute questions. So by the time you arrive at the Capitol, you'll feel prepared and confident. Thank you guys so much for taking the time to join us today. We appreciate your engagement and commitment to this effort. If you have any questions that come up about legislation, this campaign, or practices in the future, please don't hesitate to contact us. So with that, we're happy to answer any questions you have about the campaign or dental loss ratio legislation.
All right, we do have a question. What is the biggest obstacle stopping legislators from this being an easy yes?
Well, last year there were different obstacles at hand. Like I said, a lot of times legislators want to focus on the big policy issues that resonate with voters and get them into the headlines, especially with this next year being a election year. This is something that we will have to think about. So these thoughtful policy issues sometimes get overlooked. And in the past few years, we've had a hard time passing a lot of healthcare legislation. And that's one reason why it hasn't passed. It doesn't mean it won't pass. You just have to get started on it early and have that patient-provider engagement.
Another question was, after the form is complete, is there a link or suggestions to share with others? That's a great question. It is a very easy website, moreforyoursmileMo.com. Probably the easiest thing is if a patient wanted to share it, is just to share that website. That form will repopulate, open back up for anybody else who wants to send a message. Once the patient sends a message, they get a thank you response within their mobile device or right there on the screen that says thank you for making your voice heard and that kind of thing. So I think that the easiest way probably would be to, of course, share it with anybody who's coming into your practice, but then encourage your patients, if they want to share it with somebody else, just to share that website and ask them to learn more about it and take action. I don't see any other questions at this time. Thank you all. We want to be respectful for you to maybe have 5 minutes to get back to lunch before patients or whatever you have this afternoon. We encourage you again to go to the website. It's available now. Look in your mail for the toolkit to be coming. Reach out if you'd like more posters or have any questions once you get it. And we will be following up in emails to provide this video recording, link to the site, additional information to populate this out there among the membership. But especially, please share it with your colleagues, others in your practice, and help us start out on a great foot with getting a jump on this and getting this campaign message out.